Welcome back to Diabetic Flip Files. I don't know why I keep on doing this in the middle of the night recently, but this is Dr. Chi. This is where we treat wounds, we decode them, and today's episode I'm going to try to make this quick because I got a sore throat and hot cold. So we're not going to do any scalpels, dressing changes, or debridement. We're just going to zoom out and we're going to try to understand why diabetic foot ulcers keep showing up in our clinics. So we need to understand the math behind the madness. And this is the epidemiology of diabetic foot disease. And trust me, these numbers are not just statistics, these are warnings. So, what is epidemiology? You actually need to know this for your boys as well. So, epidemiology is the study of who gets the disease, where does the disease happen, why it happens, and how we can stop it. But let's simplify it. Epidemiology is pattern recognition at scale. So it's stepping back and asking the questions like why does one country have more amputations than another? Why do some patients never ulcerate and others spiral? Why do outcomes differ even with the same diagnosis? And as a clinician, you treat one foot at a time, but epidemiology is trying to understand the population as a whole. It treats the populations. So let's start with the foundation. Diabetes is not just a disease, it's a pandemic. Pandemic means like a world, right? Like whole world. So over 500 million people worldwide are living with diabetes. And then the number is projected to exceed 700 million by 2045. And here's where it gets real. Up to 25% of diabetics will develop a foot ulcer in their lifetime. So let that sit. So that means 1 in 4 patients walking in your clinic is at risk of a limb-threatening condition. So there are two key epidemiological concepts. There's prevalence. Prevalence is how many people currently have diabetic foot ulcers. Incidence is how many new cases occur over a period of time. And so why does that matter? Because high prevalence equals chronic disease burden, high incidence equals failure of prevention. So in diabetic foot care, both are high, which tells us something very critical. We are not just failing to treat, we are failing to prevent. And I think everybody knows that now because it's way easier to prevent diabetic foot ulcers than treat an actual diabetic foot ulcer. But it seems like it just gets into our clinic when it actually comes and gets worse and it's more life-threatening. So now let's talk about the statistics that should shake everybody, even clinicians. So remember, this is truth. Every 20 to 30 seconds, I think it's mostly 20, somewhere in the world, a limb is amputated due to diabetes. And here's the part that most people don't understand. 85% of amputations are preceded by a foot ulcer. That means that most amputations are preventable. So, but prevention is not happening at the scale that we would like to help prevent the patients from getting diabetic foot ulcers. And that's the whole point of this podcast. Okay? So, epidemiology identifies patterns. Pathophysiology, pathophysiology explains them and let's connect the two. So, what are our major risk factors when it comes to diabetes? Peripheral neuropathy, peripheral arterial disease, poor glycemic control, foot deformities, think about intrinsic minus foot, and previous ulcer or amputation. Now, here's the epidemiological insight. The strongest predictor of a future ulcer is what? Is a past ulcer, okay? Because recurrence rate is high. So the strongest predictor of having a future ulcer is is because you had an ulcer in the past, okay? That's why we always ask you, have you had an ulcer in the past? Yeah, I had an ulcer, but it was on a different side, on a different toe, or even in the same part, okay? But the recurrence is a silent epidemic. So up to 40% of ulcers recur within a year, up to 65% of ulcers recur within 5 years. So it's not an acute disease, it's a chronic vulnerability. So let's talk about location because where you live can actually determine whether you keep your limb. And that is the truth. Another fact, okay? So high income countries have better access to care, multidisciplinary teams and approach, and lower amputation rates. Low and middle income countries have delayed diagnosis, limited podiatric services, higher infection rates, and higher amputation rates. And this is where where you work becomes quite powerful. So in certain places like developing countries, there is a growing diabetic population, but limited structured limb salvage teams. And this creates a huge gap, a gap where amputations live and thrive, unfortunately. So epidemiology doesn't just look at the patients, it looks at the system. So you need to ask yourself, is there access to podiatry? Are there wound care centers around? Are there vascular surgeons available? Is there patient education? And here's the truth. Amputations rates are not just a medical issue, like we said, it's a systemic failure of the healthcare system. So regions with multidisciplinary foot clinics, that's great. Early intervention programs, that's great. Having significantly lower amputation rates, that's the goal. So let's dive deeper. So infections are a major driver of poor outcomes. So most common organisms of diabetic foot ulcers include Staphylococcus aureus. I'm going to say that again: MRSA, Streptococcus species, gram-negative rods, and anaerobes. But epidemiology shows something very interesting. Microbiology varies by the region. So in let's say clients, warmer climates, there are more polymicrobial infections, but in resource limited settings, there are more advanced infections at presentation. So again, location shapes your outcome. So also you have to keep in mind the mortality rate, okay? This is a statistic that a lot of people don't talk about because we are not trying to be fear mongering but it's also good to know the truth behind the disease. So 5-year mortality rate, there is a 5-year mortality rate after a major amputation that exceeds by 50%. So that's comparable to many cancers. So let that sink in. We're not just dealing with limbs, we're actually dealing with life expectancy. The ulcer is actually an indicator of that, unfortunately. So keep that in mind. That's why it is very important to check your feet every single day and prevent that ulcer. Okay. So epidemiology reveals the cycle. So here's a diabetic foot cycle: neuropathy, then the trauma, then the ulcer, then the infection, then the hospitalization, then the amputation, then the reduced mobility and increased mortality. And then loop keeps on going. Okay. It gets repeated on the other limb. So when it comes to prevention, here's the good news. Epidemiology doesn't identify the problem, it shows us where we need to intervene as well. So proven intervention strategies for diabetic foot ulcerations is routine foot screenings, patient education, proper footwear, glycemic control, and early treatment of minor lesions. And like we said, a multidisciplinary care can reduce amputations up by 85%. Everybody knows if they've been in medical school, 85%, you feel like a winner if you got that on your grade, okay? So that's not small improvement, that's a revolution. That's a huge deal. So multidisciplinary approach. So what is the future of epidemiology in wound care? So where is it going? AI, they're going to be using it for predicting ulcer risk, wearable sensors detecting pressure points, smart insoles, remote monitoring. You know, epidemiology seems to be evolving from reactive to predictive. Okay, so that's really good, and that changes everything. And like I said, I was going to make this episode very short because I'm coming down with lead code. So what did we learn today? That diabetic foot disease is not random; it's a pattern. It follows patterns. It follows the healthcare system, and it follows the gaps. And if we understand those patterns, we can break the pattern. We break the gaps. Okay, and because every statistic is a patient, an actual human being with family, life, support system, everything, okay? And behind every percentage is a limb. And behind every number is a story waiting to be changed. So this is Diabetic Foot Files, where we don't just treat wounds, we study them, we understand them, and we fight to end these wounds, okay? So this is Dr. G, and I hope everybody's going to have a great weekend because take care of your feet because they take care of you.